Cases of measles have decreased in Colorado, but state health officials want to keep communities aware of how their tracking system works. Our Kyle Kawamoto has more on what the process entails.
This is a really important, still relatively new surveillance system that is becoming more important as we have limited clinical testing.
Officials at the Colorado Department of Public Health and Environment are still on alert for cases of measles that may be lingering around the Centennial State.
And so we can assess the health of an entire community with these wastewater samples to determine disease trends.
Back in May, the agency kicked off a pilot project testing for measles in wastewater. This process allowed them to evaluate the test sensitivity and set a reporting threshold for local health departments. The project offered an opportunity to detect measles in Mesa County when they were first spreading.
So we were able to detect measles genetic material in wastewater before any of the clinical cases were identified.
We reached out to Mesa County Public Health for comment on this tool. Deputy Director Erin Minnereth responded in part. The detection of measles in Mesa County wastewater was part of a pilot project exploring how wastewater testing can support early identification disease activity in the community. At the time, notification protocols were not set. There was a short window between the detection of measles genetic material in the wastewater and confirmation of our first measles case in Mesa County. Once we confirmed the initial case of measles, we notify medical providers in the community, end quote. CDPHE officials say this tool is going to be the future of health surveillance, allowing them to identify disease trends in Colorado communities.
Yes, this is another layer of surveillance data that we can provide to the public to help them assess their disease risk and make decisions about vaccinations.
Kyle Kawamoto, KREX News.
Officials say the agency had a 2-day lead in Mesa County before identifying any clinical cases. This gave them time to message the local public, health partners, and then notify providers in the area.